Welcome everyone to London Business School Wheeler Institute for Business and Development COVID-19 series. Today we are very pleased and happy and honored to have with us Mushfiq Mobarak from the Yale University. Mushfiq is Professor of Economics with concurrent appointments at Yale School of Management and the Department of Economics there. Mushfiq has been doing very interesting work actually on a plethora of relevant issues: rural-urban migration, gender issues, the role of democracy on policies in many developing countries. He has worked, if I'm not mistaken, on more than 10 low-income frontier and emerging markets: Bangladesh, Malawi, Brazil. Mushfiq, thanks a lot for taking the time to be with us today. We are very happy to have you here with us and discuss some of your very topical research about COVID-19.
Okay, yeah, thanks very much for having me. This is my pleasure.
Yeah, so my first question is, I know that you have been working on social distancing policies in developing countries and frontier economies. In the COVID-19 series at the Wheeler Institute, we had our colleague Andrea Galeotti, who has been thinking, among others, about optimal social distancing and optimal testing. But there are, of course, big differences between industrial countries and countries such as Bangladesh, for example. So can you tell us a bit about the similarities, the differences, and the challenges?
Yeah, for sure. So I started thinking and working about this a few weeks ago when COVID was hitting. And what prompted me is that, unlike, say, Zika, Ebola, these other viruses that affected us in the last few years, this was unusual in that it started in rich countries. In Europe, North America, they were hit early. And so a lot of the lessons we were hearing about were all coming from rich countries. Because, as you can imagine, if something happens in the United States or in Western Europe, that captures the international media's attention and it sucks up all the oxygen in the room. And then what happened was, as the virus then traveled, usually through migrants down to the global south, so those countries had to adopt some policies in response, but it was very difficult for them to adopt anything that looks different from the ones from the rich countries. It's difficult because, regardless of what decision you make regarding social distancing, whether it's lockdowns versus allowing the economy to operate, right? Either decision will cost a lot of lives, and politically it's very difficult for you to make a decision that looks different from what the United States is doing and is costing lives, right? And so that prompted me to think about, okay, should we be following the exact same policies in poor countries, or should we be adapting them in some way, right? And the way we thought about doing it is that there was this really influential model in the Imperial College model that was influential in the UK and the US, right? My thought was, okay, let's just add some economics to this and put the developing country numbers in it, and let's see if you get a different answer, right? And the answer is that yes, you do definitely get a very different answer. And let me just show you a little bit about exactly why you get the different answer, right? So these are the papers that we wrote, and there are three key differences that I want to point out, okay? So one is that the demographic structure of low-income countries is very different than high-income countries. The age distribution is very different. So for example, on the left, what you see is the distribution of people above the age of 65 and low income up here, upper income over there. And you have a six-fold difference. So the elderly share of the population is 6 times higher in rich countries. And that's an enormous difference. And we know that the virus affects the elderly differently than it affects youth, right? That's one difference. And the second one is that, remember, we were hearing about this flattening the curve, right? We're trying to flatten the curve to keep it under the healthcare capacity of the country, right? And the problem is that if you're in rural Bangladesh and there are no ventilators, right? The healthcare capacity line is very, very low, right? It's difficult for us to get any extra lives saved, right? Just by delaying infections. Because if there are no ventilators now or 3 months later, by delaying infections, we're not going to gain as much, right? So then, given these two differences where the benefits are lower, right, you have to think about how they compare to the costs of imposing social distancing, because social distancing is also economic distancing. And for that, we started collecting data immediately about what the economic portions of the cost might be. And what you observe is, so here the idea was, let's take some samples where we have been collecting data. Because I'm a development economist, I do a lot of primary data collection, applied microstyle work. We had samples in Bangladesh and Nepal, so people in rural Bangladesh, rural Nepal, we were following around. And so we continued through phone surveys to ask them questions immediately after the lockdown. So here I'm showing you data from Nepal, right? Here's what economic activity looks like across seasons in Nepal when they were tracked between September and January of this year, right? And then here's the lockdown, and here's what happens right after lockdown. And there's a huge drop, even relative to sort of the low seasons in the agricultural like crop cycle. Okay, and this also leads to food insecurity. So now, and the food insecurity, like people worried about not having enough food, that reaches like lean season levels. So as people who know about agrarian rural economies know, that there are some pre-harvest lean periods, right, where there's widespread hunger, and that's what we're seeing. So now the problem is that this is during the harvest that Nepal is experiencing this, right? So come lean season in July, August, September, I started to think about what might happen, right? So because of that, we do think the costs and benefits are different for those three reasons, and therefore our policy, strategies we might want to adapt it to fit the realities of any given country.
So I think what you mentioned is very interesting, because typically we have this tendency to extrapolate from the settings of some countries to others. So for example, we had with us Leonard Vanchekon last week describing West Africa, where so far we don't see many deaths or many incidents. And of course, people tend very quickly to generalize, oh, they don't take social distancing there, perhaps we should be doing the same in the United Kingdom, for example. So I think what is really interesting from your work is that given the stark differences on, for example, the age profile, you can very easily see how much an optimal policy in the UK is way different than the one, for example, in Bangladesh or in Nepal.
Right. And also the implementation capacity in these different countries are also different. I mean, it's one thing to just say that we're going to follow the policy, but actually enforcing the policy, implementing is going to be, the capacity is going to be very different in West Africa versus in South Asia versus US or UK or Israel or South Korea or China, right? And in the US and China, it's actually going to be different in this regard as well. And there, you have to then also in terms of what academics can contribute, you have to worry about like these models, the epidemiological models that we've been reliant on in the US and UK. You can't just transfer these models over to poor countries without adding some behavior to it, without adding some economics to it. So why would you add economics? I just gave you those answers, using the Nepal data, right? There's hunger, there's food insecurity. Those things matter just as much as like sort of a virus disease risk, right? And why do you want to add behavior to it? Because if you implement a policy and it turns out in rural areas you have imperfect compliance, right? You need to take those into account in order to devise the optimal strategies.
So what can governments do in a more practical setting in, for example, Nepal or Bangladesh?
So we are now in a place where, it's no longer this discussion that we're having about lockdowns or not, right? I think we've gone past that. Right? I think there's widespread acknowledgement that, like a total lockdown versus a free-for-all, neither is the right policy. We need to think about smart ways of containing disease risk while limiting or mitigating the risks to people's economic livelihoods. Right? So now the strategy is more about, okay, how do we scale back these lockdowns? Okay. And for that, one of the most important things, maybe it's not surprising coming from a social scientist, is that we need data, right? We need much more specific information in given locations. So maybe I can show you one other graph with some data, just to give a quick picture of what type of data might be useful. Okay. So why is it that West Africa or Benin, as Leonard must have talked about, is different from India or Bangladesh or Ghana for that matter, right? So it depends on migration links. So in the global south, the virus traveled through returnees, right? And it turns out you can having returnee presence in your country or in your jurisdiction, whether it's a district, sub-district, right, is strongly predictive of whether or not the disease is going to emerge and spread there, right? So based on that insight, we took we basically put together lots of data from the Bangladesh government, right, that was already in administrative records. So for example, data from the Civil Aviation Authority on all the airport disembarkation cards. Okay, so as people were returning between December and March of this year, right, where did they come from? Did they come from Italy, Singapore, Korea, where the disease was prevalent at the time, as opposed to from France or some other country where the disease was not as prevalent, right? And based on those cards, you can also get people's addresses, so you can understand exactly what districts or sub-districts they come from, right? And so that can create, and that's not the only source of data. You can also get data from a different government agency on like where migration permits have been handed out in the last 10 years for which country, right? And then what we find is that, you know, you can create sort of a risk exposure index, right? That's kind of geographically specific, as you see here at the sub-district level, right? And then you want to validate this measure. So we compare it to, say, Bangladesh doesn't have great testing, which is one reason this type of data is important, right? Like many developing countries, we don't have extensive testing. So we want to validate this by comparing these exposure index, right? And directly compare it to where distress calls are coming from, because the Bangladesh government repurposed one of the, the information line hotline into kind of a COVID hotline, right? And then once you do that, you see that, these migration exposure index, correlates quite well with the distress calls, where the quarantines are happening, etc. And you can also, of course, apply the same approach across countries, right? Because each country has an exposure index as well, right? That allows you to maybe guide WHO and other multilateral partners, development partners, on exactly what are the countries that might be at greater risk, where the disease is likely to show up early, right?
And I guess one could even use telephony data or
absolutely, yeah,
Facebook.
Yeah, and you'd want to also add, I was showing you sort of international migration data, right? You'd want to use exactly other types of connections. So, so just as an example, what we're doing right now is that we have a partnership with the telecom service providers, the mobile service providers in Bangladesh. And they, because they can pick up exactly where a phone, what cell tower is pinging into, they can create like countrywide indices of sub-district to sub-district movements, right? So you'd want to use that type of data to also track where the disease spreads, because initially the international migration tells you where the disease arrives, and then the internal mobility will tell you where it spreads.
So Mushfiq, of course, how countries can respond is a function of the state capacity of the country, and for example, how targeted the transfers perhaps could be, and more importantly, taking more macro perspective is the fiscal space. So for example, Germany can adjust to this, but some other countries, especially in Africa or parts of Asia and Latin America, cannot do that. So how can this play out in your analysis?
Yeah. So for one, in the analysis I already described, the reason I was talking about the cost as being in terms of food security and in terms of hunger is precisely because if you're a country that, along with a social distancing guideline, you can pass a $2 trillion budget that sends relief to people, right? That's a very different situation than if you're a country where you say social distancing, therefore economic distancing, but it's hard for me to get money to you, right? And now we have to think about that implementation capacity, right? So now we are in a position where many countries need to send relief payments quickly to people who are suffering, right? And but then in order to send relief payments quickly, you need that infrastructure in place, which many countries don't have. So just as an example, in the United States, last year everybody submitted tax returns, virtually everybody. So the government could easily figure out, okay, who earns less than, say, $50,000, $75,000, and we need to send money to them. And you can send a bank transfer, right? Now imagine in Bangladesh or many developing countries where maybe 2% to 4% of the population submits tax returns, right? How do you quickly identify who needs support at this time, right? And beyond that, there's also another phrase that's emerged in Bangladesh, the new poor, right? So there's new categories of people who are suffering at this time, where their livelihood has been taken away because of the social distancing, right? And they don't fall under the pre-existing social benefit transfer systems, right? So now the question is, how do you actually identify who needs support, and how do you send money to them quickly? Because regardless of what decision we make around social distancing and lockdowns, right? It's clear everybody agrees that we need to send money quickly, right? So here, let me maybe share a little bit with you again with slides on what are the inputs that are required. And I'm going to draw your attention to the block here on the left, and then the block here at the bottom right. Okay. So here's the trick that we have to use. So that basically the Bangladesh government, and now we're working with the Nigeria government on the same problem, right? You need to send money, right? You need to identify who the poor are, right? And that's a difficult task. So the trick that we're using is that, you know, there were, as I mentioned earlier, there were these samples of people who, you know, when I know the statistical representativeness that I have been tracking, right? So I had baseline data on them based on, say, in-person surveys with them for other projects that have nothing to do with COVID, right? From last year, okay? So I've tracked them over time, okay? That's one. And second, you know, the problem is that you know, I only have such data on about 15,000 such people, right? But when I do have it, I have great data, so I have kind of the ground truth on who's poor and who's not, who needs to be targeted, who's not, out of the 15,000, right? And you can match that, and now that I'm doing phone surveys on them, you can also get further information for those 15,000 households on who is suffering the most right now, who's experienced the sharpest drops in income. So for example, we observed that migrant families, the remittance-dependent families, are suffering more than others, right? And the reason is those, the migration pipeline has totally dried up, right? People can't send money because of the global crisis. Okay, so now you have this great ground truth data for 15,000. The problem we have is, but how do I get that same kind of information quickly for 150 million people, right? And the trick that we're using in partnership with Josh Blumenstock, who's in the School of Information Science at UC Berkeley, is that given my data on the ground truth, right, if I merge in from the telecom service provider their cell phone usage data, right? Now, it won't surprise you to learn that you and I use our cell phones somewhat differently than poor people do, right? So in terms of the frequency of top-ups, in terms of the size of our network, the frequency of our calls, our use of calls versus SMS, right? How our friends who we're calling, how they use the network. And there's a lot of different categories and factors that kind of represent sort of subtle patterns in cell phone usage that differs between poor and rich, right? So if you can train a machine learning model to pick up those subtle differences, right, then what you can do is get a predictive model, like an algorithm that says, okay, if I use patterns like this person has a higher likelihood of being poor, right? And then you can send an SMS to people, right, and ask them a few questions in order to refine your method further, right? So that's a way that we use a combination of survey data, economics data, machine learning, modeling, sort of computer science modeling, put it all together and send the algorithm back over to the cell phone providers, and they can quickly apply it to the entire population, their entire subscriber base.
I find this super fascinating because it combines, you know, the very micro work with big data and artificial intelligence. I think it's also the future, partly of our profession, but also saving lives.
In that case, let me tell you the kind of the funny, almost an epilogue to this, which is, yes, I also found exactly this super fascinating because, like you, I'm a researcher, right? So I really think like, oh, let's put data together. This is machine learning. This is all great, right? But how I've been spending my time for the last 3 weeks as we're working on this is mostly about the politics of how does one implement something like this. Because you can imagine that there's going to be a lot of legitimate and other concerns with this. So one is that there are politicians, I mean, while we have proponents of this type of strategy in government who've asked us to take on this task, right? There's going to be other people in government who would prefer to use sort of list-based, the traditional approach, right? That we make lists and we send out funds, because that has a different sort of political economy calculus than doing something that's machine-based, right? And on the other hand, we also have to worry about things like, you know, how do we address the subset of the population, let's say 10% of the population that don't have access to cell phones, right? And we know in Bangladesh that men are much more likely to have cell phones than women. Are we going to inadvertently sort of exclude certain groups from benefits, right? So we have to worry about those things a lot. But then to get this project working, about the politics, right, we also have to get multiple cell phone providers to cooperate with us, right? And that itself is a complicated task because they're in a competitive environment with respect to each other.
Yeah, so since you mentioned politics, I want to conclude our discussion with two questions that I'm asking almost everyone who is kind enough to contribute to our COVID-19 series. So the first is, what could the government, let's say the G7 or the G20, do on that? And then my second question, but let's take them one by one, is like, what can business do here? And perhaps large multinationals that operate in emerging markets and frontier economies, or even big, large corporates?
Right. So on the first one, on government, especially governments in rich countries, right? So this is the virus by its very nature travels, right, from one person, it's human to human transmission, right? So therefore, solving the problem in one location and leaving it and not solving it, or leaving other countries to fend for themselves, is not ultimately going to work, right? Because the virus is going to get re-imported, right? Like no country is now moving towards sort of having herd immunity, and therefore when it gets re-imported, you have yet another outbreak in your hands, right? And therefore we really do need a lot of global coordination in order to address this properly. The role of multilateral institutions like the WHO will remain really extremely important, right? And I think, you know, what's happened in the world since, like, after World War II, there was this wide recognition for the importance of global coordination, and many such institutions got built in many different sectors, like World Bank, IMF, but also the United Nations, and many other multilateral bodies, as you know. Now, somehow, for the last, 50 to 70 years, I guess we've slowly forgotten the importance of the global coordination. And around the world, you see sort of nationalist sentiments emerging in the United States, in the United Kingdom, in Brazil, in Hungary, in India, right? In China. And you really have to, I think the world needs to reset, right? And think hard about, when we have global challenges, what are the right institutions and right sort of coordination bodies that allows us to address those challenges. Now, on the business side, of course, an easy answer would be business needs to invest in people, right? But I think what I've learned over the past few weeks, in working on the coronavirus response in Bangladesh, and then in a few other countries, is that some unique ways in which some unique comparative advantages that business has is unique types of data, right? I just gave you an example of how cell phone service providers, right? They have access to information that nobody else has, including the government don't have. And the reason is that even researchers don't have that, the government doesn't have that. And the reason is that there's one, technology that basically everybody carries in their pockets, and that's a mobile phone, right? And that sort of helps you collect a lot of information. Similarly, when we move to the stage of beyond relief targeting, of actually sending money over, again, business can play an important role there. Like there is, like in Kenya, in Bangladesh, there's now mobile money providers. They've replaced the traditional sort of brick and mortar banks, because those, that particular method of providing financial services wasn't very cost effective, right? So there are many ways in which business can contribute, and it's important that business and government and researchers get together and figure out how to coordinate and collaborate. Right?
I like to keep this word coordination and cooperation. So with this, Mushfiq, thank you very much for taking the time, doing all this fascinating work and getting some minutes to talk to us. We look forward to reading some of your very exciting work. Thank you very much.
Thanks very much, Elias.